We're also ready to provide $10 million through the Canadian Red Cross to the Indian Red Cross. This will support everything from ambulance services to buying more PPE locally. If you want to donate to the emergency efforts on the ground, go to redcross.ca.
Canada is responding to the COVID-19 catastrophe that's unfolding right now in India. The country is reporting more than 300,000 new cases a day and nearly 3,000 deaths. And those numbers are believed to be an incomplete picture of the real extent of the crisis. Medical supplies, including much needed oxygen, are starting to arrive. This shipment arrived today from the United Kingdom, for example, with that country pledging more will be sent. So what is the federal government here prepared to do to help? Karina Gould is the Minister of International Development. Hi, Minister. Good to see you. Thank you for making time for us.
Yeah, glad to be here.
So the Prime Minister earlier today said that your government is ready to provide $10 million through the Canadian Red Cross to the Indian Red Cross. Can you provide us with a concrete timeline about when that will happen?
Pretty much immediately. That's why we're making this transfer, is so that it goes straight to India through the Indian Red Cross to help people in need.
And do you know specifically what that money will be used for?
Yeah, so the Indian Red Cross is on the front lines of the fight against COVID-19 in India, and this additional resources will go towards helping them with their ambulance service, for example. They're constructing new isolation centers and quarantine centers for those who are sick and are unable to isolate on their own. It's going to help them procure PPE locally as well as additional medical supplies.
I wanted to ask you a bit more about the medical supply aspect of this, because I listened to the Prime Minister and Minister Anand earlier today, who said there are kind of multiple levels of conversations occurring. Is there a plan, or are there plans to, for example, donate specific medical equipment to India above and beyond this one contribution?
Yeah, so the answer is yes. We are just having conversations with counterparts in India. So, for example, Minister Garneau spoke with his Indian counterpart this morning. We've been in constant touch with the Indian High Commission here in Ottawa to make sure that what we're offering is what's needed on the ground. And so we're just doing that analysis, because what we want to ensure is that if we do send any additional supplies, that they're what's needed and that they can be used, and that they're used effectively. So those conversations are ongoing, but we felt it was really important to get support out the door immediately while we do that assessment.
Is there any indication of what India will be asking for? My understanding a few days ago when I listened to various ministers comment was that there had to be some sort of specific request from India. In the meantime, we've seen lots of other countries, particularly in Europe, Germany, France, as well as the UK, Australia, the US, Israel, Singapore, all make pledges of specific medical equipment to send. Do you have any idea like how soon you'll know what we're sending?
Within the coming days, so we're assessing what we have in our national stockpile here in Canada. Of course, we're in the midst of a very aggressive third wave here. So we want to ensure that whatever we're sending is access to what we need here in Canada. But then also, we're coordinating with allies around the world as well to make sure that, we are all providing what's needed in India. So those conversations are very active, and we are, acting quickly, and we will be sending additional supplies. We're just doing those assessments.
The crisis there is certainly, at a level that's almost unimaginable, rather, but it has been building pretty consistently, at least over the month of April. What do you say to critics who say we could have been acting as fast as the UK, which made its first delivery there today?
Well, so we've acted very quickly. I mean, today we announced $10 million to the Indian Red Cross. That is support that is going to help immediately. We know in humanitarian crises, and COVID is no different, that we need a range of supports. And so providing cash assistance to the Indian Red Cross will help them immediately with their response on the ground. But we also know that, when it comes to humanitarian responses, we also have to make sure that we're working with the other country, responding to what their needs are. And so we've been having conversations with the Indian government now for over a week. And, the requests have also been changing over that time as they do, the assessment on the ground and what their needs are. So our response has been immediate in the form of $10 million to the Indian Red Cross. And I would encourage Canadians who want to contribute and want to donate to go onto redcross.ca. They have an appeal for the response in India. It's a great way for Canadians to contribute. We will continue to do those assessments and have something more to announce in the coming days.
Are you considering, is your government considering matching donations as you've done in past crises with the Red Cross?
Well, we're actually trying to see if Canadians will match what we've contributed to the Red Cross already. One of the things with matching funds is that, we often wait until we've hit a certain point, but we knew that we needed to act quickly and get those resources there immediately. So I would encourage Canadians that if they do want to contribute, the Canadian government has put forward $10 million to the Red Cross. It's a great vehicle for them to make a contribution and to know that their donation is going to have a real tangible impact on the ground in the health response to COVID-19 in India.
I take your point, Minister. My question, though, was whether or not, if let's set aside the $10 million that the government is already putting forward, are you considering matching whatever donations come above and beyond that from Canadians?
Well, first of all, we've made the $10 million donation right now. We're going to continue to assess the situation on the ground, see how the needs evolve. We've been following the situation as we've been following the situation right around the world. And so, this is going to be evolving, and we're going to continue to watch, to analyze, to monitor. And if there are greater needs, then, Canada will be there and ready to respond. But right now, today, we've made this $10 million pledge commitment, and we are also looking at what additional supplies we can send, but we'll continue to monitor the situation into the future.
So at this moment, not considering a matching program. Just before I let you go, Minister, I did want to ask you about one other aspect of what's happening in India, and that's the vaccines we had been expecting. We know from the Serum Institute, we know they're delayed because of what's occurring in India. Do you have any sort of updated timeline about when we might expect the doses still on order, essentially, from India, from the Serum Institute? Is there any definite answer from them on that?
So my understanding is that they're still committed to fulfilling that order, but they have put export restrictions in place given the current situation in India. And I think as viewers can see, upwards of 300,000 cases a day and still growing. The situation is, as you mentioned, completely unimaginable. But those conversations between Minister Anand and the Serum Institute and the government of India are carrying on, but I don't have further information at this point.
Okay, so no definite timeline for them at this point, given what's going on there. Accurate?
Correct. Not from me. Perhaps Minister Anand has more, but I don't.
Okay. Thanks, Minister Gould. Appreciate your time very much. Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.